Hello class, my name is Lisa Rudd. It's nice to meet everyone. I am a new graduate nurse. I graduated in May of 2017 from Forsyth Tech Community College in Winston-Salem. I am currently working as an oncology nurse at Wake Forest Baptist Health, and I've only been a nurse for about 2 months, so I'm still learning. I'm actually still in orientation. There's a lot to learn, and I'm learning that juggling responsibilities as a nurse is extremely challenging. In addition to me beginning this program for RN to BSN, which I started in June of 2017, I've completed 2 courses, and this is my 3rd course, and I'm also taking with the Pathophys course. I would have to say that my short-term goal is to complete my BSN and to successfully work as a nurse for a year, and then from that point decide what area I might want to branch out into, if I want to move into a different area of hospital nursing or possibly move into working in an outpatient clinic. I also have a strong interest in possibly doing clinical research. I was a scientist before I went into nursing. And part of the reason for the transition was that a lot of the science positions were becoming contract and unstable, and I was just looking for something that would build on my prior experience, give me a lot of opportunities for growth, and also a little bit more job stability. I've only had one nurse manager as a registered nurse. That's my current position. So far she has been very supportive and encouraging with my progress as a student nurse. Started on the unit with only 1 patient, worked up to 2, then 3. I'm now at 4 patients. Usually the workload is a 4 to 5 patient load, and again, if you have 4 patients that are high acuity, that is a pretty high load. So I'm still, I would say, have my plate full in learning to juggle my responsibilities and taking this coursework. I would have to say, for a negative leader, I would say one of my clinical instructors was a great nurse, but she didn't provide feedback. I think she was a little hesitant to provide feedback. For example, I needed some work with my prioritization. Only found out about it formally from her when I had an end of course evaluation, and even then we didn't have a one-to-one discussion. It just said on the form, needs improvement with your prioritization skills, and she just simply handed me the form and said, please sign this. So I would say that it's hard to have a touchy-feely conversation about something that's it's easy to have a conversation about something positive, harder to have a conversation about something negative. But I do think I would have benefited more from that slightly negative conversation, especially with feedback for how I could improve. So I would only say that's the negative experience that I had. How that affected my attitude and motivation, and did make me feel a little bit hesitant to embark on my career as a nurse and to be on the floor as a nurse, because I felt, oh, am I good enough? Can I do the job? Does she really think that I can be a good nurse? So it sort of planted a little bit of a seed of doubt in my mind, and I do think that a stronger manager, if it were put the right way, could have said, oh, Lisa, you do have an area to work on, but this is how you can overcome that obstacle. So that is my feedback for now. Look forward to meeting everyone and learning some valuable leadership skills in this course.